When we started the Hotze Health and Wellness Center, it was a result of an illness my father had had. My daddy, when I graduated from medical school in 1976, held a party for me, a banquet down at the Houston Club downtown. And over dinner, he turned to me and said, "Son," I said, "Yes, sir." He said, "Don't poison your patients like all the other doctors do." That's what he told me. So he planted a seed in my brain. And I went into emergency medicine after that for 5 years and opened up an occupational and a family practice on the north side of Houston. And it's called the Day and Night Clinic because I worked day and night. We had eight kids and, you know, hungry mouths, they needed to be fed. So while Janie, my wonderful wife, by the way, Janie's here, and she and I'll celebrate our 50th wedding anniversary this September. And I know somebody told me today they had turned 50, and I said, you know what, enjoy your youth while you have it. So anyway, fast forward to 1988, a lady came into my office that I've been taking care of, and she lived at a retirement center across catty corner from my office, and I said, "Miss Jones, how are you doing? First patient in the morning." She said, "Dr. Hotze," with a big smile on her face, and nobody ever smiled when they go to the doctor's office. Nobody felt well. They're always sick. And she goes, "Hi, Dr. Hotze. I feel like $1 million. Ever since I threw away all the drugs you were giving me, I feel like $1 million. So I thought about this, you know, don't poison your patients like, I said to myself, this woman's smarter than all the other patients, all the doctors I know. She's smarter than me. She knows these drugs are killing her. She doesn't feel good. And then my dad called up and came by and said, "Son, I want to talk to you." He said, "Son, I'm having some chest pain, you know, kind of going down my arm. What do you think?" My dad was a very successful entrepreneur. So I said, "Dad, it sounds like you got, you know, it's cardiac angina is what we call it. It sounds like you got maybe a little blockage in one of your arteries. Let's take you over to the hospital." So we took him to the hospital. Long and the short, they did angioplasty on him. I sent him to a cardiologist friend, and during angioplasty, and I'm there watching it through a window, watching the EKG screen, and about in the middle of it, all of a sudden the EKG, which was nice and regular, started going whack, 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 whack. So I called up Bob Feltman. Dr. Feltman is a cardiovascular surgeon. I said, "Bob, get over here." They just blew open his left anterior descending artery. So he had emergency heart surgery and bypass surgery. He lived through it, thank God, got out of the hospital. 2 weeks later, he called me up and said, "Son, come over here. I want to talk to you." He was not in a good mood. So I get over there to the house on a Saturday morning. He's pacing, you know. I don't know what the Sam Hill I was thinking about letting these doctors invade my body. They went in and he said, "I got a calcified artery. It's calcified, and they're going to try to stretch it? It violates every engineering principle I know." He was an engineer in the oil and gas pipeline industry. He said, "It's like the pipelines we work on. If you got a crack in them and you put pressure on them, they're going to blow." That's what they did. And he said, "Read an article." I read an article from Dr. Julian Whitaker. And Dr. Whitaker did natural approaches to health from out in Newport Beach, California. I read this article about heart disease, and here's the statistics. If you have angioplasty after a heart attack in the first year, 15% chance of dying. If you have bypass surgery, you have a 5% chance of dying. If you don't do anything but simply lose weight, exercise, take some vitamins, keep your blood pressure normal, you have a 1% of dying. He said, "Don't let the doctors invade your body." And Dad said, "What do you think about this?" I said, "Well, Dad, I didn't know about it. I mean, I wish we would have tried something like this." And he said, "Well, son, this doctor says I need to take vitamins. What do I need to take?" I looked at him like a deer in headlights. "Dad, I'm a doctor. What do I know about vitamins?" And he said, "Son, will you find out?" And so I love my daddy. I was the oldest of 7 boys. I was the oldest in the family. I said, "Yes, sir, I will." So that put me on. He said, "I'm firing every doctor I have." I want you to take care of me. Oh my gosh, he had heart failure. It blew out part of his heart. He was in terrible condition. Doctor gave him a year to live, said he'd never get out of bed. So that's why we have Hotze vitamins, is because of the adversity in my dad's life created an even greater benefit. You know, in every adversity, there's a seed of a greater benefit if you'll just look for it. And so he did. So my dad's illness got me into studying vitamins and natural approaches to health. And that's in 1989 when I decided, okay, I'm done with this. We literally got down, Janie and I got down on our knees one night in 1989 after my dad's problem. I said, Lord, I got 8 kids. And that's a heavy load. And the way medicine is going, it doesn't look very good with all these insurance companies, and I don't think I can make it this way. Would you show me what you want to do? Help me, if I can help people get well and practice medicine and make a living for my family, show me how to do it. If I can't, I'll go out and do something else gladly. I was a paint contractor. I go back painting houses, have a paint contracting business. I have no problem with hard work. So anyway, 2 weeks later, I get called by the administrator at the Katy Hospital out of the blue, recruiting me to come out to the Katy area. That's how I ended up out in Katy, is because I got recruited by them out there. They, of course, were hoping I put patients in the hospital, which I did initially. I had a few that we did. But as things evolved, we got into natural approaches to health so we could take care of people. We could help each one of you obtain and maintain health and wellness naturally. And this is what we believe, and I believe this for decades, that everybody needs a doctor and a staff of professionals who can coach them on a path of health and wellness naturally. So as you mature, you enjoy a better quality of life. You're not like all your friends or like your parents were, kind of barely making it around, and but you got vibrancy and you're enjoying. If you're alive, for crying out loud, you ought to feel alive, right? Don't you think? And so that's our philosophy, and we do that without pharmaceutical drugs. And you all, each one of you, are living proof that it works. How many of you want to go back and throw away all your natural vitamins and natural hormones and go back to your conventional doctors and be on antidepressants and blood pressure? How many would like to go back? No, I'm not going back. So if it weren't for each one of you being our guests, that's why we exist, is to serve you and help you get healthy and well. And that's why we wanted to throw this luncheon, is to say thank you very much. I am very grateful, and everybody on our staff is very grateful. I would be remiss if I didn't also mention Monica Ludicky, who's been the president of our organization, and Monica has been with us for 28 years this September. I've got 3 important women in my life. My mom and I have been together now for 68 years. JD and I for 50 years, and Monica's worked with me for 27 years, and all of them. And so Monica, back in 1996, my office manager came to me, had been wearing me down. You got to join these HMOs. You got to join these PPOs. If you don't, you're not going to have a practice. You're going to, we won't have anybody. And I said, okay, whatever, just go do it. She just wore me out. And Monica heard me say that to her, and she came up to me in the hallway of our current office, and she goes, Dr. Hotze, I'll throw myself down kicking and screaming if you join HMOs and PPOs. You offer something that other doctors don't offer. Do that, and we'll always have a practice, and we'll always have people that are willing to pay for those services. So it was, and I said, you're right, thank you. And Monica's not usually that direct, but she was very direct that day, and I've written about her. So thank you, Monica, for doing that.